You are listening to the Health Highlights Podcast, sponsored by publiclytradedpodcast.com. Health Highlights is dedicated to shining a spotlight on companies in the medical and healthcare related industries. From new therapies to durable equipment manufacturers, pharmaceutical, nutraceutical, and bioscience drug discovery and development, to precision surgical tools. We highlight publicly traded companies that are helping to create a healthier future. And now, your host, Marcus Heatherly.
On today's episode of Health Highlights, we're excited to spotlight a company that's been in the addiction treatment business for quite a while. We're talking about BioCorRx. BioCorRx is an addiction treatment company offering a unique approach to the treatment of substance abuse addiction. Focused on improving the quality of life for recovering addicts, BioCorRx is a healthcare solutions company working on the leading edge of alcohol and opioid addiction treatment. And with us today, we're excited to have him as the CEO, Mr. Brady Granier. Mr. Granier, welcome to Health Highlights.
Thanks for having me on.
If you don't know about Mr. Granier, he has a very diverse background in healthcare, sales management, and business development, and he's been the CEO of BioCorRx since June of 2013. If you would, please tell us a little bit about yourself and your company.
Well, as you mentioned, BioCorRx is an addiction solutions company. We also working more now in the weight loss space as well. But the company has been primarily focused up until now on treatment for opioid and alcohol use disorders. So we have a behavioral program, a medication-assisted treatment program that couples sustained-release naltrexone, which is a drug that's been approved for many, many years by the FDA for alcohol and opioid use disorders. We built a behavioral program that has cognitive behavioral therapy and peer support that's offered to treatment centers around the country, built around the use of sustained-release naltrexone in injectable or implantable forms. So we have that program that's been available for quite some time. 3 years ago, we formed a pharmaceutical subsidiary to take products through FDA approval. And we're currently seeking FDA approval on a naltrexone implant for opioid and alcohol use disorders. So that's one of the main projects we have going right now in our subsidiary. And then we're launching our weight loss program later in the fall called the UnCraveRx program. So that's dealing with weight loss, which is also an addictive disorder.
Yes.
So we're helping to manage the food cravings for individuals with that program.
Got it. So speaking of the naltrexone implant, back in January, you guys had major news announced about being awarded a grant by NIDA, which is the National Institute of Drug Abuse, for approximately $5.7 million. Can you tell us more about that grant and what it means to move BioCorRx forward as a company?
Yeah, so we were successful in receiving a grant for that particular naltrexone implant. We have several formulas of naltrexone implants, and this is one particular one that's not being used in individuals at this moment, that we're taking through the regulatory process. And we chose that one because that product, a similar product to that one, is already approved in another country. And we acquired a lot of the data on that product and know-how. So it was we felt it was a product that we can take through the regulatory process more efficiently. So we applied for a NIDA grant. We were successful in that, and the announcement was in January. The funding started in February. So the project has been underway for a few months now, and we're looking forward to taking that all the way through the 505(b)(2) pathway, which is an abbreviated pathway. And so the studies are just about getting underway here soon, and we're hoping that we'll hit our milestones, because if we hit our milestones, there should be more grant money available to us in a couple of years, should we need it.
If you don't know about BioCorRx, folks, check them out. They're on the OTCQB. They're under the ticker symbol BICX. Mr. Granier has a detailed background in healthcare and business development, and recently they announced a pilot program with the Louisiana Department of Corrections to help those suffering from alcohol and opioid use disorders. Can you tell us more about this program?
Well, we've done a few of these similar things around the country over the years. As I mentioned earlier, we have that behavioral program, the BioCorRx recovery program, and it was built around the use of sustained-release naltrexone, primarily implants, a different type of implant than we discussed with the FDA project, some that are made from compounding pharmacies. And the company was started around that type of product many, many years ago. And we've been able to do things like we've done with the Department of Corrections with other municipalities like the city of Anaheim and another entity in Philadelphia.
Got it.
Where we're piloting this out. I mean, we're not studying anything. It's basically the program that's been used by several doctors around the country for many, many years. we just have some of these government entities that have looked at using something different, and they're basically just using it. So it's not a study of any kind. We're offering those products and services to them, to patients that raise their hand and want to help. So we're happy to help when we can. We're really focused on getting that other implant through the FDA approval process. But in the meantime, when someone wants help, we're not turning our back on people that want to get help now. And that's kind of what we're doing with some of these programs. And it's building good relationships with those entities as well for later on when we do have that other product approved. So, the Louisiana Department of Corrections is one of those, like a few others that we've done. And, we've been talking to them for several years, and they kind of, lean forward and want to do something different and offer something different to people in light of this epidemic. We're happy to help when those situations arise, and those aren't really, money-making endeavors for us. It's really, developing those relationships, and we are helping some people that want to get help.
Exciting news out that just released July 22nd about your UnCraveRx on-demand virtual fitness, lifestyle support, and nutrition app. If you would, give us the skinny on the details of this great news that just came out.
Yeah, we're very happy about that launch. The UnCraveRx program is another medically assisted program that uses anti-craving medication to reduce cravings, help people lose weight, and it's also coupled with nutritional coaching and behavioral support, which is ultimately the most important in any of these types of treatments. Is you really want to have people change behaviors. And the app is a part of that entire program. The app was ready now, and since it has tools that are available now to individuals, we want to get it out there and let people start downloading it. And we are offering a 30-day free trial on it for anyone that wants to try it out and take part with all the nutritional and behavioral components that are in there while we wait for the full program to launch later this fall. So it's probably also a good time to get any bugs out of it that we may have. So we wanted to launch the app as soon as it was available, so we can, start to get some learnings out there with it being used.
Sure, and some things, especially when you're talking about technology or a little bit of trial and error, you guys have obviously excelled in the addiction space, and I think are poised and prepared to do well when you talk about people that are just looking at having healthy eating habits and not even necessarily weight loss, but obviously weight loss is related when we talk about those kind of things. Mr. Granier, before we finish, is there anything that we didn't get a chance to talk about today here that you would like to spotlight for our Health Highlights listeners and your investors?
Well, I think that it's important to note that we've also just added new independent board members to our company. In fact, one of them was just interviewed on Yahoo Finance to talk about our company. And we also raised $6 million over the last few months, after we got the grant money. So the company is capitalized for now to do the things that we want to do. And so we're on good financial footing there, and with some really good strategic investors behind us that believe in us and are members of our team now, not only by investing, but actually, in the office helping us every day because they believe in the mission. So I think it's important for people to understand, who we have behind us on the financial side as well. On the scientific end, we have a really well-rounded scientific advisory board of experts in the business when it comes to naltrexone. So we really put the pieces together. In the future, we'd love to be able to uplist to a larger exchange like the NASDAQ. We've been working on that. We have to wait till the market conditions are appropriate for us to do that. And some other things that we need to do with the balance sheet. But we are working towards that on the investor side of things.
Mr. Granier, I do appreciate you coming on Health Highlights today. It's been great to hear from you directly and give us a little bit more details on some of those things. Folks, if you're not aware of BioCorRx, they're on the OTCQB under the ticker symbol BICX. I think definitely undervalued where they're at currently, and a very good long-term play, excellent management in place, and excellent things that they're doing as far as treating opioid addiction and now getting into weight loss management. So, Mr. Granier, thank you for coming on today. We hope that you'll come on in the future and give us an update with other good news that you have coming up. And again, we appreciate your time today. Thank you.
And thanks for having me. Really appreciate it.
This audio interview was entirely sponsored and produced by Publicly Traded Podcasts, which is responsible for the content. The opinions and information provided in this audio interview are those of the guests and those of the respective companies that they represent, and do not necessarily reflect those of the team or management of Publicly Traded Podcasts. All listeners of this audio interview are encouraged to do their due diligence and research when planning and executing investment strategies. We strongly recommend seeking the assistance of an investment professional. The guests interviewed may have paid for an extended audio distribution package and are in no way affiliated with Publicly Traded Podcasts or their audio distribution partners.